Come join us each week as we dive into topics about the joys and the struggles of motherhood. By no means are we experts. We're practically flying by the seat of our pants, or should I say, mom jeans. On this podcast, you will find a judgment-free zone where we discuss not only the best parts of being a mom, but the not-so-glamorous parts too. You can expect unfiltered, real mom talk, humor, grace, and a sense of sisterhood. What makes our podcast unique is that we understand there's no one-size-fits-all approach when it comes to being a mother. We're not going to pretend that we know everything too, because we definitely don't. We just want a place to share our stories with you. Thank you so much for tuning in to Mom Jeans, trying to fit into motherhood.
Welcome back to Mom Jeans, the podcast. I was gone last week and I super missed you guys. I listened to Nina's episode and it was awesome. I definitely want to check out her book. So very excited. So if you didn't get an opportunity to listen to last week's episode, you definitely should jump in. Nina is an author and wrote a spicy novel that sounds super, super interesting. Lisa read it and said it was great. And so that was an awesome episode. So I am back after a week-long vacation. So happy to be here. This week we have Danielle, Lisa, and my near and dear friend Tiffany joining us. So this week Tiffany is going to be joining us to talk about her journey and road to motherhood. It was not without bumps and challenges along the way, and Tiffany is one of the strongest women I've ever known who handles everything that comes her way with grace. Going to get a little choked up because Tiffany's been one of my best friends for 15 years now at this point. I think if math is correct, I don't know if math is right or not, but
I was actually thinking about that the other day in the shower. I think it is around like 15 or 16 years.
That's crazy. But we've been through a lot together, and there's been a lot of things that we've really been able to relate on in life. Some unfortunate circumstances and challenges that have brought us even closer over the years. And for that, I'm super, super grateful. So, Tiffany, we're really excited to have you this week. I know you have a lot to share, and you're going to really probably reach a lot of women with the stories that you have to tell us today. So we will, per usual, kick off our episode with everybody's high-low for the week. I will go first. So I was in Hawaii last week with my dad and my sister and Wesson, and it was absolutely wonderful. I was incredibly stressed out and concerned about the flight there and back with Wesson, with a 15-month-old. And my high for the week is that he did great. It was amazing. It was like, honestly, the most delightful 6 hours of the week, both times. So super, super happy about that. On the other end of the spectrum, my low is that my dad is definitely getting older and it's starting to show. And he had 2 really bad accidents at the airport when we first landed in Hawaii, and then at the airport when we were trying to leave Hawaii. And that was just really emotional and hard. And he was pretty shaken up, and it required a lot of assistance from a lot of other people to kind of get him back on his feet and to get him on the flight home. But, I think that just sucks to see your parents aging. And when we landed in Hawaii, the airport brought the wheelchair to us, but then they left us with the wheelchair. So I was trying to push my dad in the wheelchair and then push Wesson in the stroller, and then have Wesson push our suitcase carry-on. So it was quite entertaining, to say the least. I was in a full body sweat, and then this like very, very, very kind man came up and was like, "Do you guys need help?" And he jumped in and pushed my dad the rest of the way to baggage claim, which was much appreciated. So the kindness of strangers definitely showed a lot through those experiences, through both times he fell. But so my high was my trip, and my low was also my trip. So Danielle, how was your week?
Well, first off, let me say Ryan and I were just having this conversation about like our parents too, just getting older. And I'm sorry that that happened and that makes me sad. But then your visual you just gave me made me laugh. So I'm sorry. Like, yeah, I was just gonna imagine like you pushing your dad. Maybe your dad could have pushed the stroller and
That was what Steven said
and then
too. And so we tried that, but it wasn't working in that way. So my dad was trying to wheel it was it was comical. I mean, the sight is pretty entertaining. So I was pushing my dad with my right arm, and so then my dad was trying to hold on to the stroller with his left arm, like to the side of it. And then Weston was trying to hold on to the suitcase with his left hand. So we were like all a team effort. But yeah, it it was worthy of a laugh, the sight for sure. But
right. Yeah, I feel like I realized my parents were getting a little older. Hopefully, they don't listen to this episode. But when we went to Hawaii, also, and I tried to take them snorkeling at the Black Sand Beach, and the wave was just too strong and knocking them over. And my mom almost had a panic attack, and I thought she was going to drown in like right there. And my dad also had a panic attack, and they just went back to the beach, and they were so embarrassed because like the wave took them over, but they were also laughing about it. And but it just made me so sad because like they're the ones that taught me to swim, and it was just hard to see that. But yeah, so moving on, like my high of the week, I'm not sure if I have a low. I guess the low was going to be that I'm weaning Weston off of his passy, and I thought it was going to be terrible. He cried wine for like 10 minutes, and then he went to sleep. I'm like, all right, well, we'll see. He's gonna wake up in the middle of the night searching for it, like, where is it at? And he might have woke up a couple of times but went back to sleep, and literally the next day he didn't even look for it. And I swear he's been sleeping better now that he doesn't have the passy, because he just knows it's not there, and so he just rolls over and goes back to sleep. When used to, he'd wake up, and if he couldn't find it, he was like up in the morning. So he's been sleeping till 7:30. I know there's moms out there listening to me right now like, what in the world? No, that was not my experience. But I'm really blessed that I have a good sleeper, and I feel bad for saying that, but he's pretty good. And he was easy to sleep train, and he was easy to get off the passing. And Ryan and I were just like terrified of doing it, like, oh, we don't want to lose sleep. But he did pretty good. So that was my high of the week.
that's awesome.
Started out as a low to a high. Yeah.
What inspired you to wean him off the passy now?
I know, Lisa, you said that the way their teeth grow doesn't matter, and that's probably exactly like doesn't matter because they're going to fall out. But I've noticed his two bottom teeth are starting to kind of go inward, and I'm thinking it's because of the passy. But I'm not a dentist. He actually has a dentist appointment next week, but I'm not sure if they're just growing that way or if it was the passy. But then also just like, I don't know, I want him to be able to put himself to sleep, if I didn't have a passy, because sometimes we forget it when we travel and it's hard to keep up with. And so it's just one less thing to worry about, I think.
That's awesome. That's a huge accomplishment.
Yeah, he did good. Way to go, Weston.
Lisa, what's going on in your world?
Yeah, so we have a couple of things that happened. So Aubrey got her tubes this morning for her ears. So she, they warn you them coming out of anesthesia is a little bit shocking because they're very confused. They compare it to like waking up drunk for the first time and being like, wait a second, what's happening? Why am I dizzy? Like, this is really confusing. And it really confused them. And she was just crying. And it was like, it was hard, but we'd been through it with Hannah before. And I was like, oh, this won't last long. It's all right. So that was probably the low for her, but it's interesting. So even like right when we got home, she started making like consonant noises, which she's never done before. So like they say that it's also kind of eerie to them because they can hear differently as soon as they get the tubes in, because the fluid's out of their ears. So it's a little bit clearer for her. So I'm thinking that she just started to hear clearer, and she started like playing with her mouth and being like, oh my gosh, this is so different. So it's very cute. She was like, really like, she kept like surprising herself. It was very sweet. So that was a plus, but yeah. And then Hannah's is pretty funny. So it's like, so we took Hannah through the car wash probably for the first time when she was like a year old or so. She wailed. She was terrified, terrified, terrified. So we were like, all right, that's weird, right? But Arizona kid doesn't get to see rain much. She's probably like, what is this wet stuff? So we took her through like a couple more times and she still wailed, so scared. So we went and had breakfast the other morning, and it was across from a car wash that just opened, and it was giving free car washes. And we're like, oh, let's go get a car wash after. And we told Hannah, we're going to go get a car wash. And she was like, no car wash, no car wash, no car wash. She's like, knew she was scared. And we're like, we're going to go and get a car wash, Hannah. It's okay. If you get scared, you can just close your eyes. It's going to be okay. And the whole time we're in the line waiting to get in there, she's like screaming. She's so upset with us for like forcing her to go through this car wash. We get in the car wash and she was fine, like totally fine. And we get out of the car wash and she goes, Hannah didn't cry. Hannah didn't cry. She was so proud of herself. And then like, I can't remember. Oh, I think we saw like Michelle or Ryan the next day or the next, when we got home, and she was like, Hannah went through car wash and no cry. And she was like so proud to tell everybody that she got through the car wash without crying. So today she was like, we were talking to her about, when you're afraid of something, it's okay to close your eyes or whatever. And she said, yeah, Hannah closed eyes during car wash. And we were like, oh my gosh. She keeps talking about it. I mean, we went on Sunday, I think, and it's Wednesday. She's still talking about the car wash. She's just so proud of herself. And it's just so cute to see like the language develop to be able to talk to you and like you to, she's piecing words together, but you understand the gist of like, she's just so proud of herself, and it's just so cute, and I love it. It's such a great, great moment. So, but yeah, and I know I already did a low, but the lows, definitely the sleep deprivation right now is like, it's been really challenging I'm a big sleeper. Like I'll fall asleep mid conversation. Like I love my sleep. I'll fall asleep anywhere. But having a rough time. Hannah's doing her stuff, waking up in the middle of the night, still waking up, before 5 a.m. It's just a lot. So when that happens, like it's really difficult for me to formulate words, and I like can't, and that's my big thing is communication. Like Brandon knows what's on my mind always. That is just the way that we work. I just work that way, and getting tired, that communication broke down a little bit this weekend, and it got really difficult. And Sunday was a really challenging day for us because when we're not on the same page, it makes parenting really difficult, right? When you're fighting each other and you're like, no, she can do that. And he's like, no, she shouldn't do that. And it's like, you're at each other the whole time. But very thankful, he has adjusted himself because I'm not as good at adapting to situations. But that night before we went to bed, we talked it out and we're like, all right, if this happens again, we're going to do this. And it's like, it was nice that we did that. But that Sunday was like a long day and really difficult. And I hate saying on weekends, like, man, I just want them to go back to daycare. Like I feel so bad, we don't have kids to put them in daycare, but some days are hard. So that was my low, but not too bad of a low. So Tiffany, I can't wait to hear your high low.
I definitely relate to the sleep deprivation piece. I was actually trying to think what my low would be. It was overall, I'll start with my high. It was overall a really good week. I did my first solo weekend with Opal. My husband was gone to Sedona for 3 nights, I think, and it went really well. I even at one evening managed to walk her and both of our dogs.
Wow.
And it was like pretty successful. I mean, there were a couple times when they kind of like got a little caught on the stroller, but not too bad. I had like a decent system down. I clipped them to my fanny pack and then I had a split leash. So they were really close. And my one dog, like actually, this was the one thing where I was like, oh, this is going to kill this if this happens. But he was like panicking because he felt like he was too close to the other dog and he almost pooped on it. So I, for a moment was like, oh my God, this is going to be my low. But it ended, the walk ended up being overall pretty good. There was definitely like a low moment to that. I ran into someone that we know that I haven't seen in a while, and I was home alone with the baby for the weekend. I was on like cycle day 2. I was eating more chocolate than I normally consume. And I was definitely like standing in this like weird position because I have these dogs like attached to my fanny pack. And this person that I ran into that we know, like he said it in such an awkward way too, that I don't exactly remember what he said, but it was like a comment about like basically like I looked pregnant. And I didn't know what to say, but like, I wish I would have been like more on it and been like, oh yeah, this is a chocolate baby. But like sleep deprivation, like I thought of that when he like rode his bike away. And I was like, man, like I miss being able to like communicate like I used to, and like formulating words and like being sharp. And I was like, I think what my real love, like other than like, yeah, people shouldn't comment on people's bodies, like it's best to not say anything. But like, it really got me thinking about how I'm just like not communicating like I used to. And it really is, it's like this compounding sleep deprivation. I'm an exclusive pumper. So I recently dropped down to 4 pumps. I'm trying to do like a really slow wean. And I don't know, just like the shift in that, the slight hormone change that happens. And like, you know, you try not to define yourself by your output, but like, you know, I'm starting to wean. So I see I literally see since I pump, I see the ounces go down. So that's a little hard sometimes. And that was probably since I just started that and that like hit took place. And I was on my cycle too. So that I take a huge hit with that too. So that was really probably like my compounding low, because I let that get to me a little too much than I should. But yeah, it was kind of all like mixed in with like the sleep deprivation and the changing of things. I've still kept my middle of the night pump. I think I'm going to drop that when I go down to 3.
That is, I will say, from my first, like dropping that was a game changer for me for the sleep. And I started to be able to formulate words back again a little bit more. And it was like, oh, it's temporary. Like we try to say that in this podcast a lot. Everything's so temporary. Tiffany, if you don't mind me asking, how old is Opal?
Opal is like a little over 8 months.
So
yeah,
fun.
She's getting like more and more fun. Like, you know, just the progression of it. It is all like really fun. She's actually starting to mostly sleep through the night. Like she still has like a couple wake ups, but she babbles herself usually back to sleep.
Oh, good.
Yeah, and that really just started around like the beginning of this month. I think, you know, now that I've like upped her to 2 meals a day, and she's like actually like figuring out how to eat now.
Oh, nice.
I think that that's like helping her just be more full and able, because she used to wake up around when I do my middle of the night pump for a bottle, and she just hasn't done that for, I think like she did it randomly the other night, but really for most of this month she hasn't done it, which has been really cool.
Yeah.
So Tiffany, I want to paint a picture, because you're talking about how, you know, you used to be quick with those comebacks to when somebody would say something. And I can vividly remember, I think it was an Arrow Bowl, which was one of our sorority events. And one of the fraternity guys called you a not nice name. And you immediately responded with, well, thank you. That's my favorite word. And he was so caught off by it. Do you remember that?
Actually, yeah, I haven't thought about that in a really long time, but no, I
hadn't thought about that until
it is actually one of my favorite words
just now.
Still,
it's a great word.
Yeah,
but you know, I hadn't thought about that until you just said that. And I was like, she was like really quick with the comebacks. Like you threw people off.
Yeah, I normally am like on it and like, yeah, but it's just like, and again, I think it was in part because of how awkward it was, and I'm balancing like 2 dogs and a baby, and it's just like, oh, missed opportunity. If I had just been a little bit more like slept, and then I could have maybe got a little bit closer to having something good to say about that.
Well, thank you all for sharing that. Sounds like, you know, everybody had a relatively good week. So that's good. But you know, Tiffany, we're really here to hear your story from conception to Opal. So we'd love to just kind of hand it over to you and listen to what you have to say and share her story, your story. I mean, it's your your family's story.
Yeah, definitely. It's both of ours, right? Like, yeah. And I think about that a lot for everyone's like journey into motherhood. Like it's a story, not just like of a baby or of a parent. It's like the collective journey too. And I've been definitely something that since I've had her and along the whole process have kind of thought of that. So I guess like I'll just start at the beginning, and try and be like pretty concise with some things. So if you have questions, feel free to let me know. So my husband and I have been together for 13 years and we've been married for almost 5. And we kind of like throughout our entire relationship have like gone back and forth on like, do we really like want kids? And we ultimately like settled on wanting to have like 1 or 2. So we got married back in 2019 and I had been like coming off of some pretty serious like stomach health issues. And so we were like, okay, let's wait till probably like 2020 to start trying. And the kind of pandemic starts, but we have this like plan to go on this river trip in like the end of August, beginning of September in Oregon on the Rogue River. And it was like something that I was like, I don't want to be pregnant for, on the off chance that it like works early. So we were like, oh, well, try like on and after that trip, because I think I was actually ovulating at that point. So we go on that trip, kind of like pull all the, like I hadn't been on birth control for maybe almost like 10 years. Like we had just, managed to avoid it. I've always been like super attuned to my body and like I'm aware when I ovulate, like I feel those tinges and stuff. And I've always, especially since going off birth control, I had a really, really consistent cycle. So other than like that I was going to be like 35, I didn't have like any reason to think that I would run into issues. And actually, lo and behold, we totally got pregnant on that first try on that trip. Came back and I took a test at home probably around like 5 weeks, like what I would have been gestation wise. And then a couple of days later, I started sort of like bleeding, but not really. It was really strange. And so it kind of kept on happening for a few days. And I called my doctor and she was basically like, oh, you need to go to urgent care if you think you're having a miscarriage. Like that's like the best option. And it's kind of like COVID time. I really don't want to go to urgent care. So I actually called a couple other places in town and they all told me the same thing. So I go to urgent care and urgent care is like, yeah, you actually need to go to the hospital. Like go to the ER. They have everything there. So now I'm like, can we to go to the ER now during all this nonsense? And so I go and, I don't even like know where the ER is at. Like, so I live in Durango, Colorado. It's not super rural area, but like it's a regional hospital. And I went to like the wrong entrance. So there's like a hospital volunteer, this like old man who like volunteers to walk me to the ER, which is like wings away. And he was like, well, why are you going to the ER? And I just casually tell him what I think is going on. And he was like really touching. He said that he was really sorry. His wife and he had experienced a couple of losses and he just like knew how hard it was. And then he offered me a wheelchair. I was like, no, actually, I don't need a wheelchair. Thank you. But like I had kind of a lot of decent experiences throughout this. I will say I'm from a rural area. And so I'm kind of a little jaded on rural healthcare anyway. And so I wasn't like going into this situation like super confident of being at an ER in kind of a rural area. And so it was like a really long process. But they started with like drawing my blood and the ER doctor, she was like, you shouldn't tell me my HCG numbers, that stuff. I didn't really understand any of that then anyway, but she was like, your numbers suggest that like you've had a demise. It's pretty early on, but we'll still do an ultrasound. It took forever to get it. Got the ultrasound. The ultrasound tech was super nice. Like starts with my uterus. She's like, yeah, it's empty. It looks like it's passed. Sweeps over my right like tube and ovaries or ovary. And she's like, it looks great. And she gets to the left side and it's like radio silence. And she's like, the doctor will talk to you. And I'm like, okay. And then I start thinking like, oh, you're 35. Like, could this be an ectopic pregnancy? And eventually the ER doc comes in and she's like, yeah, you've passed it. Like it was really early. Sometimes it's not super noticeable. And then I asked her, I think I mentioned like, I think the ultrasound tech saw something, which I think set this woman off. Because she was like, well, she's not the doctor and neither is Dr. Google. So she's like,
Wow.
You've definitely probably had a miscarriage. Yeah, the whole time she actually was acting like super inconvenienced. If I'm saying that right, about me being there. It's kind of obnoxious. At the time too, I had just started my own business and I've worked in healthcare advocacy in the past, particularly in the state of Colorado where I live. And my husband and I have always filed taxes separately. It's just like part of like our makes sense for us with some of my student loans and his job. And so I had started this business and didn't really have like a huge income, and COVID was going on, and they were like, you qualify for Medicaid. And so I definitely like took up on that. But I know from working in healthcare advocacy that like some doctors have like a negative connotation and reaction to people being on Medicaid. And I did kind of feel like,
Can I ask something on that?
yeah, totally.
So do the doctors see what your insurance provider is before they come see you?
Oh, yeah.
Oh, I didn't know that.
I mean, it gets written into your file. It's on like the top of your file. And when I worked for this great organization here in Colorado, we collected a lot of stories from people that had like very negative experiences being on Medicaid and getting care from doctors, and just like there being like this negative response to it. So I always kind of wondered if maybe that was part of it. And I also did feel kind of bad. Like here I am I felt like I'm showing up to the ER for this like miscarriage, like, I don't know, the whole thing, like, and again, like going back to like having some of that, like just distrust around rural healthcare anyway. It stems from my own crappy experiences with growing up where I did, my family having experiences, and me kind of going into this with like, how is this going to go anyway? And then this like additional layer of like, oh, is she being like kind of a, because I'm on Medicaid. But at any rate, she was also just super crappy about like the whole, like, no, you're really probably not going through that. It looks like I don't see that, like, very insistent. And so I just kind of left. And she did tell me that my next cycle would be like worse than it normally is. And I normally at the time had pretty like intense cramps, and I'd get like bowel issues and stuff. So I just kind of like tucked that into my back pocket and then waited. And I will say, like, I felt like something was off, but I just didn't think it was off enough that I went to try to seek any other health care. Like I didn't even know like what I would do. I stopped whatever like kind of bleeding that I was doing, and I felt a little weird, but like otherwise I just kind of went about my life for a month. And then I had what ended up being a rupture of what was definitely an ectopic pregnancy. And so I ended up back at that ER like a little over a month later, bleeding to death internally. And it probably started really slow. They figure I probably was about 10 or 11 weeks pregnant, and it was kind of toward the top of the tube near the ovary, so where it's a little bit wider, which is probably why the pregnancy was able to grow to that point, but they still figured it was probably pretty stunted. The word that my OB surgeon ended up using, medically professional, but she's like, your tube burst, and the like contents of what was in there just dissipated throughout your body. And she figured with the like slow pulling on it, a tear probably happened in it. And because a couple days before it happened, I felt kind of crappy, like you do, like maybe when you're getting the stomach flu or something. And then nothing happened, and I kind of started to feel better. And we actually had this like little cul-de-sac Halloween COVID-friendly block party where we were outside, and one of our neighbors made a whole bunch of like Velveeta cheese nacho dip. And I hadn't felt good for a few days, and I was starving. And so I ate so much of this shit. And then the next day I woke up and my stomach really hurt. And we were going to like deflate our rafts over at our friend's house. And we're like moving the rafts, and I feel just this like kind of slight twinge. And I had started bleeding a little bit that morning. So I was like, oh, this must be like my cycle returning. And I went inside, and they had like a split level house, and blood loss is a crazy thing. Like this should have been a clue to me that something was wrong, but I kind of needed to like sort of like half crawl up the stairs to get to the bathroom. And then I came outside and I sat on the stairs, and I had this brief moment where I was like, you know what, I need to go to the hospital. And then I was like, no, I'm fine. It can wait. Like, it's no big deal. Eventually, like, I ended up in my friend's room. The husbands took care of the rafts. I don't know. I was probably there. We figured that point where it ruptured was like a little after 10 in the afternoon, and I was at 10 in the morning, and I was at the hospital by 2 in the afternoon. And I was like fully in and out of losing like consciousness in their room, but still like convincing myself that I'm like just having this really bad period. And like my thing was like, no. Like I'm having this bad menstrual cycle after a miscarriage, and I ate a lot of Velveeta cheese. That was like my story. And overall, I think for a good chunk of it, I looked okay. And then by the time I crawled out of the room, I was at a point where I didn't look okay anymore. And they were like, oh, we need to call an ambulance. And so we got to the ER, and Brett kind of followed behind. We had to leave our dog at our friend's house. I think overall it was definitely a traumatic experience for everyone. It's clear that I was not in this good state. And my girlfriend, whose house we were at, had thought, oh shit, I bet she didn't pass all of the contents. She thought I was having some sort of septic issue. And they gave me some fentanyl in the ambulance so they could palpitate my belly, because my belly didn't distend, and it wasn't firm to the touch. And the OB figured that what had happened is it had been slowly bleeding for a couple of days, and this little path formed between all my organs. And when it ruptured, it had this flow to follow. And so the pain that I was feeling was blood pushing in between all of my organs. And so we got to the ER. They made me put the mask on, which was awful. I think this accumulation of you're at definitive care. Your body can kind of stop keeping you in this state of survival mode. Cause I definitely was having experiences of being here and then being somewhere totally different when I was in and out of losing consciousness. I would wake up between the bathroom and the foot of their bedroom bed and not remember how I got there, but remember being in these I don't know, just interim different, it was strange. So they wheel me into the hospital. I'm kind of loopy and weird. The mask is not helping me. The nurse won't let me take it off. And the ER doctor comes in, and speaking of, I was still a little on top of it here at this point. And it's sleep, severe blood loss, and I can slightly be on top of it, and I can't do it with sleep deprivation. But the doctor comes in and he takes the mask off my face. He's like, oh God, if this is bothering you, take it off. He's like, tell me in your own words what is going on. And I was like, this is my first cycle after a miscarriage, and I ate a lot of Velveeta cheese. And he looks at me and he was like, oh yeah, because an all too common side effect of Velveeta cheese consumption is loss of consciousness. He leaves. He's like, I'm going to go get an ultrasound machine. So he comes back in and he puts it where I'm facing, is the right side of my body is facing him in the machine. And he puts it up, basically at my liver. And I look at him and I was like, that is not where my uterus is. And he's like, you are correct. And then he swings the little ultrasound thing around and he's like, but this is all blood. And at that point, Brett had gotten there and they were letting him back in. And the doctor was like, I'm 99% sure you've got a ruptured ectopic pregnancy. And then at that point, it was get her blood, get all these tests, get her prepped for the OR. The hospital does always have an OB surgeon on staff. So there was someone there. It was during a point in COVID where they were lifting some of their restrictions. And so they were allowing more elective surgeries again. And I hadn't thought of this, but definitely as a part of rural healthcare, they were like, oh, you're in luck. We're actually going to kick out this elected surgery. And there was an appendix rupture here earlier this morning. So we don't have to bring anyone in. And I'm like, bring anyone in? And she's like, yeah, the anesthesiologist and the OR prep nurses. And I was just like, oh yeah, because I live in a smaller area and those people just wouldn't be there, especially kind of during the times we were living in at that point. And that all was kind of a blur. I went into surgery and they completely took my left tube out. She had the surgeon who was scheduled to do the other surgery stay to help get the blood out of my abdomen because they knew it was probably going to be a lot. And they pulled out 2 full liters and then rinsed me with another 8 liters of fluid before they finally felt that I was running a content of clear enough liquid that was acceptable to them. And she said, because they went in through the belly button to kind of get an idea of what side it was because they couldn't see on the ultrasound because there was just so much blood blocking everything. And then they figured out it was the left side, cleared everything out. And from the pictures that they gave me, you could see coagulated blood stuck on the outside of my uterus and stuff. And she was like, yeah, it's probably like that throughout all of your organs.
Do you still have those pictures?
I do, yeah. They're in a cabinet behind this wall in my garage.
I would be so interested
I've
to
always
see
meant to
that.
kind of do something with them. Yeah, definitely. I would show it to you. It's like there's a picture of like before. Honestly, I should have pulled it out. A big picture of before they took the tube out and what it looked like, and it was just like shredded. And then what it looked like taking it out, and then there's like a picture of like what my normal tube and ovary look like others on the other side, and you could see like the remnants of like how stretched it had gotten, because I was like, oh, what's that purple stuff? And she was like, oh, that's like your stretched out fallopian tube. Yeah, it's crazy. I also, in like kind of the beginning, after he had said it was a ruptured ectopic, I was like, how the hell did that happen? I was like, I was here a month ago and I asked about that. And he was like, yeah, I'm going to look at your file. And funny enough, down the road, like later, I got curious and looked like through my hospital records and saw his name, and I looked him up online. And just like the luck of the draw, right? He works at that ER. Why wasn't he working there that day? His Twitter, or now X, whatever it is, bio line at the time was, I can find anything on an ultrasound.
Wow.
Yeah, I know. But that's just not, I mean, and kind of going back to what I was talking about in the beginning, it is a story, right? And it's all of our story. It's not just mine. It's not just hers. I believe that my path to having this like specific child that chose to come into my life started with this. And so had that surgery, honestly, I think from like the ER stay till the next day, I was in the hospital like 22 hours. They loaded me up with so many pain meds that by the end, the next morning, I was like, you have to stop. Like I'd had 3 different types. Like I just needed to, like, I felt like I was in outer space still. Like I was like this, plus coming out of anesthesia, like I'd never had surgery before. And like with that, where they like blow you up, like with whatever that gas is, so they can like see inside your abdomen, like in my case, my abdomen. Just like the nerve pain it ended up causing, there was just like a whole slew of things. And then, losing that much blood, I think at the end of it, I can't remember, I got like 4 or 6 units of blood. And then,
sorry, Tiffany, to interrupt. So did your doctor or anybody say that they should have picked it up on the first time that you went to that hospital?
no one said that outright, because I think that's like opening a door for liability.
Got it.
But I do believe that he probably saw it. I think you had to maybe be looking a little bit harder. I still to this day believe the ultrasound tech saw it. It wasn't in the more like kind of common spots where they do get stuck. And I actually, like, thinking about it, when I was much younger in my 20s, I had an IUD. And I didn't keep it in very long. I ended up being one of the few people who had like a lot of problems with it. And it gave me ovarian cysts, was one of the things. And I had a pretty decent sized ovarian cyst on my left side that ruptured when I was like 28 or something. And I always kind of wondered, since it was that side, was there some damage to my fallopian tube then? And that's like what caused the blockage there. So it also might have looked a little just different on the ultrasound. Who knows? I'll never know. And thank God I lived and my family didn't have to necessarily try to sue them for missing something like that. But they told us to, like, it could be a couple months. It could be like whatever, when your cycle returns, try and give it like 1 or 2 goes and before you start trying. And it came back like 3 weeks later, and then the next one was like 6 weeks, and it started to be really random, but we gave it a couple, I think like 3 months, and then we started trying. My OB had said, like, once you start trying, give it like 6 months, because I was 35. And if it didn't work, to kind of come back. She said losing one of your tubes like that isn't like a cut of your fertility in half of like 50%. It's actually a little less than that. I will say through this process, I learned more about my body, and like, it's embarrassing. Like, I should have known this kind of stuff. And really, honestly, like, IVF taught me so much that I didn't learn.
We've talked about that on a previous episode of how we didn't know anything until like we started to go through some of this stuff.
Yeah, it's crazy.
Tiffany, were you afraid to try again? Like, were you afraid of this happening again?
No, you do have an increased chance of having another ectopic after you have one, but kind of talking to my OB, she was like, the chance is really higher if you didn't lose your tube. So like if you catch it before the point of rupture, there's another option where I can't remember what the shot is called. It's some crazy name, but they give you a shot a couple of times, or sometimes one time it works, and that'll help kind of really, I think like what it does is like kind of dissolve. I could be wrong about that, but the pregnancy that's tissue that's in the fallopian tube. So there can be damage that's left behind, or sometimes people can get surgery where they can get it cut out. But again, like some damage is left behind, and you're actually more likely to get an ectopic in the tube when it's left. And so she said, really, I didn't necessarily have as much of an increased risk. They also did that test where they shoot dye into you. And my other tube was great. So they weren't concerned about that. At that 6-month mark, she ran the kind of standard tests that OBs do for me and my husband for fertility. And she actually referred us to the clinic that we used. She had a doctor there that she had a lot of patients that used. And I was still kind of hesitant. Like, I really just like, I was very apprehensive of like the process of it. I'm not a huge fan of needles. The idea of all of the medications that went into it, like I just really, really didn't want to go that route, but I knew in the back of my mind, I knew just in my being from the beginning that was actually going to be the route that we were going to have to go.
So did she refer you there only for IVF, or did you guys talk about IUI at all?
They don't recommend IVF or IUI if you've had an ectopic. That's just not something that they recommend. You can totally do it. We could have tried that option first. But with me being 35 going on 36 at that point, I was actually closer to 36 because we ended up meeting with the IVF clinic in May of 2022. And then I had my egg retrieval July 5th of that year. And so like the basic tests that the OB ran, everything looked fine other than like, hey, you're missing one of your tubes. There were a couple of things with my husband, but nothing that they were like, this actually really shouldn't be impacting his infertility. So we took that referral to CCRM up in Denver. We actually went to the Lone Tree office one. They gave me a different doctor than the one that my OB knew, but I ended up really liking my doctor. She's one of the few female doctors there at the time. And like they just kind of corral you in on welcome day. And, like I know that you guys kind of talked about that a little bit on the other times you touched on IVF. And, we were there, we did the tests. Luckily, I didn't have to do a repeat of that dye test because I will die on this hill. I don't ever want to do that again.
I think it's the worst thing that's ever happened to me.
It's the absolute worst. Oh my gosh, like insane. I thought I had a high tolerance for pain, and then I went through that. I mean, I went through 4 hours of bleeding internally and was like, no, guys, actually, I'm fine. And I went through like however few minutes of that test was, and I was like, no,
that was my in and out of consciousness test. Like,
yeah. And it's crazy to me, just like kind of on a side note with that they don't actually like recommend like a better pain management for that. I mean, it's like
take a Tylenol, you'll be
procedure
fine.
Where, yep, I've yet to meet a woman who took a Tylenol for that. It was fine. But luckily I didn't have to do that on that day. But we were there at the clinic for that first day for like 8 hours and kind of came up with a plan, and we did one egg retrieval. I remember having dreams before it that I was like, I don't know, just like giving myself injections, and it was going awful. And my husband actually gave me quite a few of my injections, and none of it was actually really that bad. I was actually kind of proud of how I overcame kind of that fear of like the needle side of it. At the time I did pretty well being on the meds, but I did crash pretty hardcore after them. I had a really tough detox period.
What does that entail? What does that mean? Like, what was the
For
detox like?
me, it's just like it flared up my anxiety really bad. My like kind of tendencies, like with my, like, I've had depression in the past, like that definitely kind of flared up again. And I just felt really like, kind of like awful in my body. Like just, you know, when you feel like you're like detoxing, like I've never like done a juice detox, but I imagine this might be like kind of like your body was feeling like if you were like only doing that and purging, intentionally trying to purge a lot of toxins. Because it is a lot of
Do they warn you
just
about that before
synthetic
doing
meds.
it?
Yeah, definitely.
Okay.
And some people totally don't have that issue, but have more issues being on the meds.
That was me.
Whereas being on the meds wasn't hard for me at all.
How did you, and sorry to back up, one more question.
Oh, no, you're good.
Did you have, like, what was the process like to decide to do IVF? Like, was that a hard decision for you? Like, you said that, you know, you knew that was how it was going to happen for you, but what was that decision like for you and your husband?
I wouldn't say it was super hard. At that point, we were pretty committed. We did want to have a kid, definitely, and we were willing to try that route. And from like the point of the ectopic to all of that was November of 2020 to when we went to the clinic May of 2022. So at that point, like, you know, we weren't, it wasn't occurring naturally. And at the time I thought you ovulated from every other side each month. It was just like do. Definitely it's not. It's like whatever side has the prettiest and best follicle, and that's the side you go from. And there were definitely months that we kind of didn't try as hard as we could have, because I was like, oh, I'm probably not ovulating from this side. And like my connection to my cycle changed, and my body changed a lot after the ectopic. In losing that much blood, my ovulation pain was different, and it was honestly like across like my whole lower abdomen, and I think it was just the scar tissue because I have 2 small incision sites, like kind of in from my hip bones, and so that took quite a few years for like that to kind of recover and not feel like something that bothers me anymore. Luckily, by the time I got pregnant, it didn't really bother me until I got bigger and that scar tissue really started to stretch. But yeah, just like my whole connection to that was different. And who knows, like when I was ovulating, if I was ovulating, like my body probably did have a lot of repairs to go through. And I think a little part of it too, the decision to go into IVF was like, you know, I was getting older. I'm a couple of years older than my husband, and you know, the success rate with getting even just eggs when you're a little bit older. So like we waited a few years, like it all kind of goes down. So it just seemed like a good time to try it and to move on it. In the process, we got 7 blastocytes that made it to testing, and then 2 of them that were genetically viable. So we ended up, so I had that retrieval in July, and then we did the transfer in December of that year. Our friends, my husband's like best friend growing up, and his wife fiance at the time, wanted to elope off the Kala'au Trail in Kauai, and it's a pretty intense hike. And they wanted my husband to marry them. And it was one of those things where I was like, well, again, I don't want to be pregnant. Or worse yet, I don't want this to have not worked, and I'm just like this cranky ass bitch. So we ultimately waited and started the process when we came back from that trip, which was great to like kind of have that. And by then I was feeling like my old self again. Like I'd really kind of processed out all the meds from the egg retrieval, which kind of put me both like in a better mental and physical space for, you know, starting meds and shots again.
Having such a gap in between the two, did you think about it often? Did you have like anticipation of, you know, this transfer at
No,
some
that's
point?
that hike, that hike consumed me. I was so fucking terrified. I am, for living in Colorado, for all the hikes that I do, like I love hiking. I don't do like a whole lot of crazy exposure. And this trail just has like hundreds and 100-foot drops on it, like to the ocean.
A lot of people have died on that.
Yeah. And actually from my research, most people have actually died in the creek crossings because they don't understand flash floods, which, being from Arizona, growing up there, you have an acute understanding of flash floods. But yeah, no, I read like something like 90 some odd % of the deaths have actually been, drowning related in the creeks. I had no anticipation of doing this transfer because I was like so focused on do not die on this hike. Like, how are you going to make it through this? I watched so many fucking videos. And by the time we were doing it, like, it was obvious that I was the only one that like prepared, that like had any expectation of like what these 11 miles were going to be like. So that actually, and so once like that was done and that kind of was lifted and was like, okay, you didn't die doing this. And, I thought the whole process of doing IVF was a very conscious process to bringing a child into the world. People talk about conscious conception a lot. And of course it's like, you know, I feel like I hear people more talking about it in like a flowery sense of like the ritual of before, you know, you have sex and make love and try and create a child. Like, the sex part of that is gone in IVF, but like I still had like so much, I mean, obviously we're still having sex, but, you know, like the process of being conscious to that kind of side of it wasn't there. But we could be so conscious about all the other pieces of like, you know, we are doing this because we want to bring a living child into like this world together. So it helped me like kind of, I'd say, reignite some of my spiritual practices that I hadn't done in a long time. And tying it into that hike, actually, like, I've never been on a hike that's demanded so much of my attention, where like my mind can't wander. And I focused a lot on mantras on that hike, and that carried around and totally through preparing for the transfer and then my entire pregnancy. And so I think that came a little bit from just how conscious and present I started being in my life, like in the practice of like going into IVF. And like, you know, we did all the things before we got to that point, you know, like the eating better, the better minerals, the better supplements, the acupuncture, the yoga, the like, you know, everything they tell you to do, we did it. And again, it was just like another thing of being just like super conscious of how I was living my life. And so I do really feel that like in this process, even though it's been full of a lot of bumps and a lot of like crappy moments, it was all part of the like story of like getting me into a place where I can be the most like present and best parent I can be because of this experience that I went through to have her. So I guess in short, I wasn't really thinking about it until that hike. And then the mindset I had to get in for that hike, coupled with how I was living my life with IVF, really kind of shifted how I went into then thinking about doing that transfer, which was like 6 weeks later.
And what, so you had 2 viable embryos. Did you guys pick between the 2, or how did that
No, they just let them do it. We don't know the sex of the other, and we didn't know the sex of the opal that we transferred. They just chose it based on their quality, and we're like, yeah, cool. We'll go with that. She was like a 4 and the other one was like a 6. And so the other one was already hatched or hatching, I think hatched at 6. And so, they can have a little less likelihood at that point of implanting. Whereas her being a 4, they were like, she's starting. Well, we didn't know that. But the blastocyte was starting to hatch. And we just, you know, I did all the things going into that they recommended. Our clinic was big on recommending acupuncture, and there were certain supplements that they suggested I explored, in addition to their kind of protocol that they put me on. And
did you do a day of acupuncture?
I did not. I was doing my acupuncture here in Durango, and they were still at the time weren't doing it anymore at the clinic. And the people that they had on their list that they really recommended were more in like Denver proper, whereas this was down in Lone Tree. And I just didn't want to deal with driving that far. And also since we were doing it in, like it was pretty close to Christmas time, in true like Colorado fashion. The day before it was like 65 degrees, and then on the day that we went in it was like -10. And so the roads were just really bad on transfer day. So it probably worked out for the best, but no, I didn't do the day of. But I think it was after a couple days after I got it done, I went in and had I think I had a couple appointments with her, and then kind of like 11-day wait or whatever it really ended up being.
How did you feel transfer day going into the appointment?
Again, I'd been like so like just engulfed in these kind of like just mantras and affirmations that I'd been telling myself. I had set up this like little fertility altar like leading up into it here at the house. And then I like packed it up, and we stayed at our friends Jason and Kelly's house, the couple that my husband married. And I like packed it up and reset it up in their guest room. And so like, I don't know, I was feeling at that point that I'd literally done everything I could. And I was at this place basically of like peace with it. Like it was going to suck if it didn't work. But I, at that point was like, it's out of my hands. I totally tested early. I didn't have a trigger shot. So, I like day 5 was like, screw it. I'm going to test. And so I knew like going into it that it had worked. And, again, rural healthcare, they were like, yeah, just try and go into the clinic on this Saturday and get your blood drawn. And it was like New Year's Eve weekend. And they're like, oh, we're like closed for 4 days. And so, my nurse was like, well, we never recommend this, but I want you to home test so we know if we need to up your progesterone. And I was like, oh, I've already done that. She was like, oh, okay. So I ended up so they would have tested me at day 11, I think, post transfer. And I didn't have my, test until like day 14 or 15, I think, because of how it fell with the long weekend. Like, I mean, I get it. Long weekends are nice, but like, there's no other option but there.
How many home tests did you do?
I don't know, like maybe 10 over. Yeah.
Did you do them every day?
Quite a few. I did, sometimes twice a day. I don't know. I think I kind of had a hard time believing that it was real. And you have to, like, at the store, they kind of come in these bigger packs. So I was like, they're here. Like, why not? But yeah. And once I was doing the blood draws, like, obviously I stopped. But yeah, early on in the pregnancy, I did have like a little bit of a bleed. I ended up having a small subchorionic hematoma. But then after that, it was like decently smooth sailing for a long time. They took me off the baby aspirin for a little bit because of the bleed, but by like week 11, it was gone. And so I think they put me back on the aspirin at that point. And I like this whole thing, like, I was like, I'm not getting preeclampsia. There's no way. It wasn't even on my radar. I thought about it like once. And then by the end of my pregnancy, I had it. So she was born pretty close to like her estimated guest date, but I did induce a few days early just because, I mean, I was so miserably swollen at that point. Like, I don't understand how no one thought to test me earlier. They were all like, oh yeah, man, pregnant in the summer. And I made the decision at the OB's office to meet a whole bunch of them. There's like, I don't know, 6 that could deliver your kid. And sweet little Nancy who checked me in the beginning, who was like on her way out, retiring, like one of the nicest people who worked there, was like, you really should see the same person, and just whoever delivers. She was like, continuity of care. And I was like, yeah, Nancy. And then I didn't. And so I wondered, especially if I had like stuck with the doctor who had done my surgery and who just knew me a little bit better, like, I naturally have low blood pressure, and what they were marking as mild was high for me. But I was just living in this like, oh, I'm supposed to look this puffy, like everyone tells me it's fine. And by the end, my feet looked like they were wearing tires on the top of them. And I remember doing prenatal yoga and like looking around at women who are like more pregnant than me and less pregnant than me. And it's like at the end of the day, and I'm like, oh, these women have ankles. Like, what the hell? It's like, this doesn't seem like it's being pregnant in the summer, which, like some of it probably was, but, the preeclampsia did get pretty bad when I was in labor with her. And so we stayed an extra day because I had to do the magnesium drip. And then I ended up on some high blood pressure medication after I had her for a little bit.
Isn't the mag drip just so fun?
I didn't I think for a little bit there, I was like riding this high of like having this baby. Cause like for the first, I don't know, 17, 15 hours or whatever, I was like, yeah, I feel great. Like, this is awesome. And my nurse was like, what's wrong with you? And then I started to feel terrible. Yeah. And she was like, there you go. There's the magnesium drip. I also had this like horrible neck and head pain. And I had ended up, getting the epidural like way at the end, like when I was about to push, because at that point we couldn't get my blood pressure down. We'd tried so much of the medication. And finally I was like, the epidural will lower my blood pressure. And I was like, I also don't think I can push at I was like sustained at like almost 200 over 100 for several hours.
Oh my gosh.
And it also turns out, in addition to how crappy the mag drip makes you feel, they nicked my spinal dura and I ended up with spinal headaches. But because I had the mag drip, they totally were like, oh, that's your problem. Like, this will just resolve like once that kind of gets out of your body. No. And it was actually the pediatrician when I took her in for like her 5-day appointment. He's like, she looks really great. Like, like awesome. And he's like, how are you? And at that point I could like not turn my neck from side to side. And he was like, I'm not an OB, but I see a lot of moms. And he's like, it sounds like spinal headaches. And at the time I hadn't been drinking coffee. And he was like, oh, well, maybe get a coffee on your way home. And he's like, if that helps, he's like, a lot of times caffeine helps with spinal headaches. And I felt like a decently new woman when they did that. But you can't take that much caffeine when you just had a baby. Like, you can't sustain the dose you need to like make that feel better. So I did end up getting the blood patch. Same anesthesiologist who botched my epidural, did my blood patch. Then I ended up having this rare side effect from my blood patch where the spinal headache went away, but then I would have, they called it positional headaches. So when I would stand up and change like my equilibrium, I'd have these short, like, but really intense headaches. They'd be like a minute. And then I had this like weird feeling in my leg. And so they put me also on steroids, which made me feel great. But then they were like, we don't even want you to pick up your 6-pound baby. So that was like 6 days of that. And then it turned out I had the tiniest bit of retained placenta. So I had to get a DNC for that. And it was the same anesthesiologist.
Oh my God.
And I had convinced myself going into that one, I was like, if it's this woman, I'm going to die. She's going to kill me. And like, when I saw her, I just like resolved, I was like, you're not going to die, but this is what is the likelihood of this? And she was like, do you remember me? And I was like, there's no way I'll ever forget you. Are you kidding? Like, no. And my new fear became not that I was going to die, but that I was going to wake up from anesthesia and start talking shit about her. Which luckily I didn't. I guess the OB called my husband and was like, oh, she was hilarious. She was talking shit about being in the hospital again and how tired she was of seeing all of us. And I was like, oh, thank God that was my reaction. Because I was just like, how do I have this person who I am pretty sure is not very good at their job? Like, oh, and it's like, Brett and I have talked about this a couple of times, but we're like getting to that like point in our lives where like people who are doctors and in these like professions are like younger than us. Mm-hmm. And it's like, not to say that they're not good at their jobs or anything, but it's like, am I becoming my parents in that regard of like, oh my God, this whippersnapper coming in to tell me about my health. And I'm like, oh, this lady who's screwed up my last 2 procedures. Oh, but it ended up being fine. It was just for something that I was just, I don't know, I guess I'd convinced myself because the journey to like have her had been just with these bumps that it was just going to be over. And it wasn't. And I think a big lesson in like our story together of like her path to coming here, to choosing us in this form that she's in. It was a big lesson for me in surrender, and how that's kind of come into like the story of how I became a mother, in the process of her being born was just a lot of surrender. I didn't necessarily have like a big birth plan that I like wanted to follow to the T, but it was like a little bit of like, if X is going like this, Y would be nice. A lot of that, like getting into the bath, you don't get to do that when you're on a mag drip. So that was like off the table. I couldn't really walk anymore, like it kind of could bounce on the ball for a little bit still. But like the one thing I really held on to was hoping that like if the situation arose that Brett could catch the baby, because we didn't find out what we were having. And I thought that would be like a pretty special moment for us. And luckily we were able to do that, like I wasn't in like the greatest place, but after I got that epidural, their standard at our hospital is, I think they call them walking epidurals. So it's like a really, really low dose. And then they like have that little like catheter. I don't know. I'm not a doctor, but that thing that's like hooked up to you so you can hit the button and it like maxes out at however much an hour or whatever. And so they put it in and I think I hit it like once and I pushed for like 2.5 hours. And I didn't hit it that many times, but at the end, she was like, "Oh, you tore a little bit and we need to stitch you up." And I was like, before they took it away from me. So I was like, I don't want to feel that. Because for all my friends who like didn't go the epidural route, they were like, holy crap, the like stitches, the lidocaine to get the stitches done was like the worst part of the experience for them. So I was like, I'm not running the risk of feeling this at all. And we were lucky enough, like the hospital here is they mean it when they're trying to become like very baby led in their practices. And so, I mean, we had like the kind of golden hour with her for like 2 hours before they finally were like, "Hey, we'd like you to get up and go to the bathroom and stuff." And funny enough, like I didn't poop at all when I was like pushing her out, but because I had hemorrhaged a tiny, tiny little bit, they put that like suppository in you. And when I sat up to go to the bathroom, I was like, I'm pooping the bed. Like, it's just like this, how did I like go through like this whole 2.5 hours and not pooping? No, I'm like, hey guys. It was just really, that was another comical like moment in it all for me. But yeah, it's definitely, it's been a journey to get here. And, Brett and I talk about it sometimes, like how different it could have looked. But in thinking about that, like, remember, like, I wouldn't have this specific daughter that I have right now. Like there could be a chance, like I could have 2 kids right now if what happened in the beginning didn't happen, but neither one of them would be the child I have now. They might be a daughter named Opal, but it wouldn't be, this, where I truly believe like the person and the being that like she wanted to come in as, like, is, it's both of our stories, but definitely like, I don't know that I would, it's hard to be like, people are like, "Oh, would you go through it all again?" And I'm like, I don't know that I would go through exactly that. But I have a lot of respect and understanding that I had to go through it to be fortunate to have the daughter that I have now. And for that, yes, I'm very grateful. But man, it was a crazy start to, from almost dying to then just like kind of the complications of like having her. And then afterwards, it's just, it has made me a stronger person for sure. It's made me the mother who I am starting to be, and I know that will continue to evolve, and how I got here will play a role in that for sure. And yeah, I'm curious to see like how the story continues to unfold. It's interesting, like, I thought the ectopic did a lot energetically and emotionally to like crack me open, right? This like literal bursting of this part of my body. And birth definitely is a comparable comparison to that. Like it also was like this bursting and this energetic and emotional movement of like things that I was like, oh, I didn't actually know I was holding on to this, or stuff that I was like, are you kidding me? I'm still holding on to this. And I suspect that motherhood throughout the whole journey will bring moments where it'll crack me open in different ways, and it'll continue to show me the things that I need to work on to continue to be the best version that I can be, which is what's ultimately best for my daughter and my family.
2 follow-up questions. One, you certainly don't have to answer because it is very personal, but the other one, you really glazed over another part of your complications with the retained placenta and the DNC.
Oh
You just
yeah.
threw that in there and then just moved
It
real
was,
fast
it
through that.
honestly was pretty small. So I had my postpartum bleeding for like 3 weeks. And then at like right before my 6-week check, I started what I thought was my period, and it looked like it. It totally did. And it kind of was there on and off for 3 weeks. And then I was like, maybe this is a little weird. And I called them and they were like, yeah, let's look at it. And sure enough, it was like the tiniest. They like said it was like a small bean that was still in there. And they thought for sure we could get it with the side attack. And I did like 2 different rounds of that and I didn't pass it. And so I was on Opal's like 3-month birthday that I had to go back in for another ultrasound. And it was funny enough, like when I went in for the first one, like it was a new gal, just starting out, and I'd had enough ultrasounds from IVF where I looked at that screen and I was like, that doesn't look right. And at that point I was kind of like, I was wondering if that what was going on. I know that like the medicine that I was on for the high blood pressure and the steroid that they put me on, those definitely like had a role in playing. Like I struggled with getting like a decent amount of milk in the beginning, and that I know was a big part of it. But this also too played a huge role in that. And so I was all excited to get it out, thinking like, I just like, yeah, gain these ounces. I'm going to actually like, this is part of that hurdle of being like an undersupplier. And it did help a little bit. I think it delayed my milk regulating. But my body was just waiting. It wanted to start my cycle again. And pretty much like clockwork, since I had the DNC, it's been 29 days. Almost to the hour. It's freaking ridiculous. But when they took it out, they went in with the little camera. I can't remember what they did one of those when I did my IVF pre-tests and stuff. But she went in with a little camera to make sure. She was like, I am going to absolutely like ensure that you do not have to come back, that there's nothing else still here. So luckily, like they did that. It at that point just felt like, of course I still have this. Like, why not? I definitely just kind of felt like if there was a small, odd complication that normally doesn't happen to people, it looked like I was going to get it. Because normally retained placenta is a little bit bigger than that and causes like a pretty substantial bleeding problem, where I was just kind of like, oh, maybe we'll bleed a couple days and we'll just stop for a day or 2 and then we'll come back. And so it was like really more annoying than anything else, which is also probably why it took me 3 weeks to even be like, hey, I actually think something's strange here.
Yeah.
If those things too would have been nice, like to catch earlier on, it might have made the like breastfeeding side of the journey just a little bit like, I don't know, I feel like I put a lot of work in to get to even where I got to with my milk supply, and those kind of things definitely just stacked against it.
Mm-hmm. Would there have been any other indicators that there was something like that there was some of the placenta left behind?
No, because we even looked at my placenta in the hospital, and like a lot of times when they look it over, there'll be like a noticeable missing piece, but this probably just looked like normal, like stuff that would happen when you birth the placenta. I also have I had a pretty short umbilical cord, and they like put her on my belly, and the nurse was like, do not pull her up. And as she was saying that, I pulled her up on me, and she was like, like her face, she was like, you have a really short umbilical cord. And it was not long after that my placenta was like out, and they were kind of like doing the tummy stuff, and that's when they're like, oh, you're bleeding just a little bit more than we would like. And so they gave me that suppository. But it wasn't bad or anything other than it made me poop the bed.
Tiffany, you can totally say no and not answer this, and that's fine. Do you guys have any plans for the second embryo?
I don't know. I think we could definitely see ourselves just being one and done. I grew up as an only child for like 17 years and I didn't really like it, but that is not like a good enough reason to have another child. It's because I didn't like being an only child. We've also kind of talked about like, we were always open to being two. I think Brett's a little bit more on the side of being one and done. And I think he kind of always has been a little bit more on that, where I was always like, man, like if I had any, it'd be nice to have two. So we've talked, we did pay the storage, for storing it for another year. Like when that came up, we, like we're nowhere near making a decision on it, but we knew that we wanted to have that opportunity. So we did at least pay for the storage for one more year. And then I think if we did it, we would probably talk more seriously about it around like Opal's first birthday. I just have to do it. Then this is where it's like back to that hill I would die on. I would not do the test again where they do the dye insertion, because you do have to do a lot of the testing again, so they can kind of see if they want to update your transfer protocol. So I don't know. It's one of those things where we're still on the fence. I don't know, kind of like initially in the beginning, even though it's like so hazy and newborny and ridiculous, but like, I don't know, me personally, I was like, yeah, I could totally see transferring the second one. But then you like get into it a little bit more and you're like actually like delirious and you're like, fucking talking about like, how do people end up with like Irish twins and like, like how do people handle that? Like, I don't know, but we might. I don't know. I guess the short answer is we have no idea. We feel fortunate that if we do want to do it, we have that opportunity. I would never do another egg retrieval. So if we tried it and it didn't work, like that's the answer. Opal wants to be an only child. I'll ride that. I'll take that as being part of the story too. Because I would never start the whole process again. It's just, I couldn't do it. My desire to have more than one child isn't that strong. I was never too attached to that idea.
When you were going through your egg retrieval, could you feel your follicles growing? Did you feel swollen?
Oh, it was so uncomfortable.
God,
yeah, I just like it. Yeah, the whole thing. Like, and props to people who do it multiple times. Like there's a dedication in that like, and this, Leah, like exclusively pumping has taught me that I am capable of far more dedication and devotion than I ever knew possible. But like that would not extend to doing another egg retrieval ever. And, I definitely know people who have done 3, 4, 5 egg retrievals and just like more power to you, but there's just no way that I could do that. And it's in part too, I think, how I detoxed from the meds. I just think I'm not willing to subject myself to that again.
Yeah.
The process is crazy. I am so thankful for science. Like, absolutely. Like the opportunity to be able to have my daughter with assistance, when it wasn't working for us, like that is something I'm incredibly thankful for. But it is crazy. Like we figured out along the way that you can do that. We actually have a friend here in town who's a year, maybe 2 years older than me. And he was like the 67th baby born to IVF in the United States. Like knows his number. Like first one born in Maryland, was in like Time magazine with his mom when he was a baby, like a whole bunch of other like first wave IVF babies born in the States.
It's wild, man.
Yeah.
It's an incredible process.
Yeah.
Tiffany, I was going to ask you if you knew anybody who had had IVF before you went through the process, that you had like a resource to talk to.
Leeah, yeah. And then I had known a couple people that had done egg retrievals just when they were a couple years younger, or even one gal I know did it when she was in her 20s. And so I had people to reference for that part of it too. And then I have another friend through family who did IVF as well. I think her daughter is pretty close to Weston's age.
Did you lean on them through the process when you had questions, did you feel like?
Yeah, definitely. I would feel like I turned to you a fair amount. And I, like, for me personally, like, it became a very, like, an inner experience and like a personal experience between me and my husband.
Mm-hmm.
But I definitely complained to Leeah from time to time about how those meds made me feel, and just like, I don't know, like, they're great clinics around the world. Our clinic, the one that Leeah used, or another friend of ours used, but you are definitely like a number in a larger like structure of like this process that helps people have families. And so it is kind of hard to not feel like sometimes that you're just a number. So I definitely had some frustrated experiences and things to just vent about that. But again, I like really liked my doctor, and my nurse was pretty decent. Some people got a lot better nurses, but overall I had a decent experience. But it was nice to have people who had gone through it, because it is just such a strange process, and I think like with any medical thing that you go through, it is nice to have like some point of reference in your life. But I mean, I had just no idea what I was getting into until I started that, like, Leeah shared like a little bit of her experiences with me and my other friend, but it's like hearing it and then like being there, and then you're like, oh wow, okay, actually this is what it's going to be like. It's just crazy.
It's such an interesting thing being an outsider and not knowing what you guys go through, right? Like you can explain it to us, but like you said, unless you experience it yourself, it's hard to ask the right questions, it feels like, too, to somebody who's
Totally.
gone through it when you haven't been through it. So that's really interesting. And I know you kind of touched on this, and I think I'm asking only because we've had a lot of conversations within our group text lately about how we felt the process went from start to finish. And we all, I think, have been in the same boat of, we're in smaller towns. The healthcare may not be the best, like in a big city kind of thing. Is there anything that you feel like you could have done differently, or do you dwell on that at all, or are you completely at
Oh yeah.
peace? Okay.
No, absolutely not. I dwell on that shit all the time.
Okay.
That's definitely part of my anxiety. Like I've been prone to doing stuff like that my entire life. I hope that it's not a trait I pass on to my daughter. I'm trying like really actively to not be anxious about things with her, which has been a good lesson. Again, like I think a lot of that conscious like awareness and presence work that I did throughout just the whole IVF process has helped me with that. But I do still wonder like how things would be if I made different decisions, if I had different choices, things like that. I think one of the biggest things that I beat myself up over in the process was getting the epidural. It's not that I'm against epidurals at all, but that led to the spinal headache issue, which kind of just was a cascade, obviously unrelated to the retained placenta issue, but like it was 5 days from having her, 6 days from having her till I got that blood patch, like, and then a couple weeks after that of dealing with the complications of that was just like a really crazy cloud is like the best word I can think of for like the start of motherhood. Like I still overall feel like it was a wonderful experience, but dealing with the headaches like that, and I've said this to my husband and like a couple people, but those spinal headaches were hands down worse than any pain that I felt in labor at all. And labor was very painful. And I think part of it, like labor, that there is this baby at the end of this tunnel. And I think part of the pain with the spinal headaches is just like just not knowing if there was like an end to that. And then to be dealing with this like brand new baby that has no instructions, like you have no point of reference when it's your first. And so like that was just like felt like a rough start. And I wondered and worried that I did like a disservice to her in those first few weeks or months because I was dealing with all that stuff. But now that I get a little bit more removed from that, I'm feeling better and better about it. I had a lot of kind of sadness around not being able to nurse her. I tried really hard, and I can't say that there's like a plethora of great lactation consultants around here, but I saw like 6 of them.
Holy cow.
Leeah, the woman I saw at the hospital, was supposed to be like, or one of the ones, I saw several there, was supposed to be one who was like really familiar with pumping. So by the time like I was like pumping more because we just couldn't get the latch thing going, that woman clearly had no idea about pumping at all. And I was really bummed that like that was their like, oh, she'll be great for you to meet with, like, because she'll try and help you with latch stuff, and then she can help you dial stuff in with your pump. 100% did not help me at all. But I did finally find a lactation consultant here in town who was like better able to be like, you've done everything that you can, and this is actually like an anatomical issue between both of you. Like, it's like not surprising that it's not working. She has like a really high and narrow and like backset palate. And I mean, I never thought about a lot of things before I had a baby, but definitely not the anatomy of my nipples. And it turns out like I have short and stubby nipples that instead of expanding more in the length direction, expand more in the width direction. And so it's just like things I didn't think about, but like, I really struggled with that before, like, because that was probably at like month 3 where I got that kind of explanation. No one else had given me that other, because it's all tongue ties or lip ties, and you don't have any, she looks great, and no consideration of like the other like oral function. So that was another like kind of really thing that I got obsessive over, was like, did I actually try enough to nurse her, because there's nothing wrong with exclusively pumping, but man, especially in the beginning when you're attached to that pump just so consistently, it was very daunting. And then the more kind of pumps I dropped over the months, just like the more freedom I felt. But then I also had to accept that I'm like fully committing to being an undersupplier by not doing like 1 or 2 more pumps, just because it's like a weight of like my mental health to like, she's fine with a bottle or 2 of formula a day, and to have the ability to do that supplementation is actually like quite the blessing. But yeah, just like those are probably the 2 biggest things that I've just been like, did I try hard enough? And then kind of just frustrated with the lack of like the care that's available, right? Like there should have been better options. It shouldn't have taken me as long as it did. It was a woman through my mom's group. She was one of our facilitators. That's like after us. So I think like she was number 6 in this town that I saw. And then I saw another 2 specialists that I met through social media. Actually, I found like a legitimate pumping lactation consultant who was like, oh, well, here's the right flange size, and here's how you use your pump, and like whole new world. But then I got like really in my head of like, holy crap, if I had done this months ago, like, would this be a different story? And I just like, it kind of goes back to that theme that like the story has had for me of like surrender. Like I can't change what I did, and what I did was the best I did, and like it was my best, like, and I can't shift that. So I try not to get wound up in that stuff as much, but again, I think too the time piece, like it just, the further away I get from it, the more I can see it with a better view, rather than like feeling like I'm too surrounded by it. My therapist at one point actually had this really great analogy. I think I was at like month like 4 or 5 with Opal, and she was like, oh, you're like, and she's this great therapist. She was a yoga teacher of ours, and she said like, your head's finally above water, but only to realize that you can't actually tell where land is. And that's still very much like what it felt like. It wasn't like I was being crushed by like the weight of all of it as much, but I could like breathe a little, but it was like still like, oh crap, I don't know what I'm doing. But the more, and now I feel like I'm actually kind of like on land, and the ground is sort of kind of underneath me. And the more like I feel like I've come back into my body and who I am now as a person going forward, I can try and be more conscious about not carrying that with me. Because when I think about like the mother that I want to continue to show up as, the anxious mother has been a theme in our like family lineage for a long time. And I'd really, really like to cut way back on that. I'd like that to be my contribution to the lineage. My mom stopped a lot of the abuse that happened to her. You know, I'm incredibly thankful for that. And I always wondered, like, what would my contribution be? Like, what could I try and stop that's been carried down the lineage for too long? And having her like going through birth, and I realized, oh, this is it. The holding on to like these, like you can't, like this is what I
That's
offer.
really cool that you're that aware of what it is you want to pass on to her, because that is so, I mean, that rings home to me, because I come from a big lineage of warriors, which creates and breeds that anxiety.
Mm-hmm.
And that's such a great, it's such a, I don't know if it sounds like you have this experience too. Like, I'm a totally different person now that I'm living for my girls, right? Like, and living to want them to be, free of certain things that I've lived with for so long.
Mm-hmm.
And I have to change my ways to get them there. And that is, I wouldn't do it for myself, but I'll certainly do it for them. And it sounds like you also see that. And that's very, very cool to be aware of.
It's a powerful way, I think, to look at things, especially when, no one gets out of life without some degree of trauma, right? But for some, there's bigger impacts and bigger things that happen. And that's kind of like how I look at the worry piece. Like, that's something that, I cannot pass down, like how can I make my life a living example of like how, it should have been for, the other people. I think another kind of circling back to like, if we do end up only having Opal, like, I can't say I was like set on having like a boy or a girl. I think just growing up, I always thought I would have a boy. And Brett actually was like, I think it'd be really cool to have a daughter, and to kind of show her like, that she can do like anything that she wants to do. And now that we have her, like, I was an only child and only daughter for, until my dad had a couple other kids with my stepmom. And, there are just a lot of women that came through that should have been mothered better. And maybe that is my opportunity here, is to finally mother someone the way all of these people that came before us, that laid the groundwork for us to be here, should have been mothered. And that to me has really kind of become like the new like living affirmation, living mantra. I try to like make this experience of like, okay, I can do better for this. And I do feel like it's a really good contribution to the world, because man, if we can put a hand in like having a generation of people that worries a little less and a little less anxious, like for those of us who really do that, like it can be super debilitating. It's definitely been that way for me at periods of my life. And so if I can hopefully help my daughter not have as much of that, or give her the tools really to work through when that does come up, because no one's totally immune to it, but some of us focus on it a little bit more than others. And so maybe as I continue to learn those tools, when she's old enough, I can kind of pass that along to her. I know I'm still pretty early into it, but I'm trying really hard to do that like nervous system regulation for myself, so that when we really get into those toddler tantrums, that I can hopefully try to call back on some of that. We'll see though. So far she's been like a pretty chill baby, and I'm kind of worried what that could mean for the toddler years.
That's what Stephen and I were saying last night. Like, we've been so lucky that I'm terrified for the next couple years.
Yeah, our nanny was like, oh man, she's like, that really is a thing sometimes, because she used to work in a daycare center too. She was like, sometimes the like chillest babies make the teenageriest of toddlers. So we'll see how it is. But I'm glad I took upon, it kind of goes back to those practices I started doing again in IVF. They're just showing up in a different way. Now in motherhood, I have less time, but ritual still can be something simple, and peace can be something that I try and find even for just a minute in my day. And that'll make, I think, all the difference in how I show up and kind of react as a mother to my daughter.
Well, Lisa has a Daniel Tiger song. When you, what is it?
It's when you feel so mad that you want to roar, take a deep breath and count to 4. And then you count to 4. And it's
nice.
I sing it to Hannah a lot because she's 2, and she's been really, she's so cute. Like Brandon's been teaching her, trying to teach her breathing methods, and Brandon doesn't do yoga, but he teaches her this thing where she puts her hands over her head, and then she takes a deep breath and counts to 4. She brings her hands down. It's very, very cute because it's like, usually it's like way after the tantrums already happened, and it's like not, but she remembers it eventually. It's very cute. More important for me, for sure, like to be doing the counting to 4. Cause like,
Yeah.
yeah, it tests your patience for sure. I mean, we talk a lot on this podcast about how people always warn you, oh, just you wait, the bad stuff's still to come. And it's like, I've found it both ways, right? Like, just you wait. It is so incredible when they can comprehend what it is you're saying. When you say, hey, go get your shoes, and they go get your shoes, and you're like, oh my gosh, holy mind blown. I am so mind blown. That's amazing. You know what I'm saying. That is such a cool moment. And then there's other moments where it's like, it's challenging, but it's always that's it. I think motherhood has been the hardest thing I've ever done, but the coolest, most amazing thing I've ever done.
The best thing. Yeah.
Yeah.
I feel that.
You guys have any more questions?
No, but I know I didn't ask any questions. They were doing a great job of facilitating that, but I just want to thank you for sharing your story. I like to just listen. And but yeah, I related when you were talking about the anxiousness and the breastfeeding and all the things. I'm like, I don't know if you could see all of us, but we're all like nodding our heads because like we felt that. But I just wanted to it's just nice to hear that, I'm not the only one that feels that way. And that's kind of why we created this podcast, and to bring on moms and just, hear their stories. And I just thank you so much from the bottom of my heart.
Yeah, thank you guys for having me. I really appreciate what you're doing with the podcast and giving me the opportunity and chance to share my story. I do appreciate that. I don't know that I've actually like sat down and kind of talked about it. Like I've written it out a lot and, kind of done that stuff, but it's different to share your story out loud. And I've appreciated listening to your podcast because like you were saying, like, it is nice to know that we're not alone, because even though like in the back of our heads, like we know we're not, right? But there's like a world of mothers out there living around us. It feels still so lonely when you're like in that room and you're holding this crying baby, or you're getting up to pump again, or whatever it is. Like all of our experiences are unique and slightly different, but they are so similar. And it is nice that there's like a platform like what you guys are doing here to talk about those things, to share those things, and to, to, I'd say, find some of the humor in it, and to also just have that like, oh yeah, it's not just me. So thank you.
Okay, so should we, Lisa? You've got
I was just gonna say, don't forget to ask the last question that we have to ask everybody.
Okay, so Tiffany, before we sign off for the evening, thank you again for being here to talk to us and walk us through your journey. And I have to say, Opal is freaking adorable. So I love whenever you do send me pictures of her. So keep those coming, please.
Yeah, definitely.
But we are asking every one of our guests when they come on, what is the best piece of parenting advice you have received?
That's a tough one. I saw that on there. The best piece of parenting advice that I've received. I don't know. Like I tune some of that out a lot because I've gotten just a lot of like stuff where I'm like, I don't want to hear this. But so I would kind of like I touched on earlier, I would say probably the biggest struggle for me in motherhood has been the breastfeeding journey. It just not going how I thought it was going to go, and pumping just was not on my bingo card at all. I didn't even know that was an option. And so I don't know if this counts as advice necessarily, but there's a couple of accounts on Instagram, kind of mother related, that I really like. And I was kind of in just like this struggling kind of darker place with just like not having the experience that I thought I was going to have with breastfeeding and particularly nursing. And there was this post, and I wish I could remember the name of her account off the top of my head. But she does these cute little things like, Mama, I woke in the morning, and then like kind of says these stories mostly from the perspective of the baby, but sometimes it's a little different. And one of them was at a request of a woman who it sounded like was ending her breastfeeding journey soon, faster than she wanted. And there was a line in the kind of story that she wrote about it, and she said, it was never just the milk they fell in love with, it was always you. And that has stayed with me so much because I'm not 100% sure I'll make my goal of the year. And you know, it hurt in the beginning, even though a formula is such a blessing, it did hurt in the beginning to like just know that I couldn't give her all of that when that was my intention. And just that reminder of like, it's not anything that you're giving them, even in a physical sense, you know, they fell in love with you. And so I would say that of all the things that I've come across has been the one that stayed with me the most.
So I think we all just wiped our eyes. I think all of us. Just
It's a good one. It definitely makes me tear up. Leeah, I'll send you the full one on Instagram. It's a really good one. And then that has her account in it. I don't know if you guys have like a resource that you keep of like really quality like motherhood accounts, but this woman, I just love all the things that she writes. But that one in particular was a really, really good one for me at the time.
Yeah. I think I've read one of hers before, and it was like, I'm crying, and it just like the baby was crying, and I was like, okay, it's fine.
They're really sweet. Yeah. I really appreciate what she does. She runs like, that's not the full point of her account, but she does a lot of those.
All right. Well, is that a wrap?
I think so. Thank you so much.
Awesome. Yeah, thank you guys.
And that wraps up another episode of Mom Jeans, trying to fit into motherhood. Thank you again so much for listening to us. And if you enjoyed this podcast, please consider giving us 5 stars so other mothers out there like you can find us and listen. If you would like, you could follow us on any of our socials at Mom Jeans the podcast. If you have questions, would like to send us your birth story, or give us suggestions or things that you would like to hear, please email us at hello@momjeansthepodcast.com. See you next week.